It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was part 1 of: my boyfriend has pancreatitis and is in multi-organ failure. How long will it take for him to get out of intensive care? Part 1. You can check out the answer to last week's question by clicking on the link below this video. And if you're watching this on YouTube, just check out the link to the website and you can get access to part 1 on the website. So, in this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is part 2 of: my boyfriend has pancreatitis and is in multi-organ failure. How long will it take for him to get out of intensive care? Part 2. This series of questions formed part of a 2-part phone and Skype consulting strategy session for one of my clients who signed up for one-on-one phone and Skype consulting with me. So, Vanessa asks: hi Patrick, thank you so much for your quick response and for your time on Skype. It has been very difficult. Most of the worst, hopefully, seems to be past, the organ failure, but I know it'll still be a long, rough road. My boyfriend is 45 years of age. He has never been treated in a way for alcohol issues. No prior hospitalizations or anything. He does have high blood pressure and high cholesterol, both of which he takes medication for, and sees his doctor twice a year for lab tests, and nothing has ever come up as recently as last October from any of the visits or blood and urine tests. An added difficulty is that we live in different cities, so that I'm not there as much as I'd like to be. Don't get to see the doctors often. I was there the entire first week and at least 2 days a week since then. I was lucky enough to be there today when a doctor came in, one that hadn't seen him before, and I requested a neurological consult and to start some sort of physiotherapy so that I can feel maybe my boyfriend is making progress. I'm very anxious to see what the neurologist has to say. The fact that I'm a girlfriend, not a wife, has been an issue for some of the staff, even though his mother has given me full authorization to discuss all his care, and she is the default medical power of attorney since he didn't have one to start off with. As for issues with staff, there was one today that really illustrates why I'm so frustrated. His nurse came in and tried to turn on the fan they have in his room, so I asked if he had a fever. The nurse said no. One of the doctors came right after, and maybe 20 minutes later she came and said she was taking blood and urine for cultures. So, of course, I asked if there was a reason, and she said he's got a low-grade temperature. And she couldn't tell me when I asked. So, have this new fever as a concern, waiting to see what the chest x-ray shows. I'm not sure if I told you he developed pneumonia in the first week, but there are no signs of any bleeding. Up until a couple of weeks prior to his admissions, he never missed work, took care of his son 50% of the time, but early February he started vomiting frequently. and having the shakes more frequent and earlier in the day. That's what prompted him to seek help. He was scared of what was happening. Thank you so much for everything, the information, and just someone who understands both sides of it to talk to. Many thanks for all you're doing, Vanessa. So here's my response. Hi Vanessa, you're very welcome. Thank you for clarifying your boyfriend's age and also the power of attorney situation. It's good that your boyfriend's mother has given you full authorization as far as your boyfriend's care goes. This can be important now as well as down the line. I can see your frustration, especially with the way the intensive care team is treating you and your questions. Don't be discouraged. Keep asking questions and continue to be difficult and demanding. I know you are concerned about your boyfriend's neurological diagnosis, and I know you want a neurological consult. The fact of the matter is that as long as your boyfriend is still agitated, confused, and probably going through withdrawal from alcohol and some of the sedatives and some of the painkillers, it may not be the right timing as yet to do a neurological consult. Maybe he needs to be less agitated first before they can properly assess him neurologically. I understand that the intensive care team is clearly and inappropriately withholding information from you, and that's why it's even more important that you get comfortable with proactively managing the intensive care team and challenge their perceived authority and challenge their perceived power. Here at intensivecarehotline.com, I can give you all the tools and strategies to do that effectively so that you can have peace of mind, control, power and influence quickly. Besides your boyfriend's fever, which is nothing unusual or uncommon after 5 weeks in intensive care, which they'll probably treat with the appropriate antibiotics, the next challenge is to wean your boyfriend off the ventilator and off the tracheostomy. Now you got to keep in mind, you also mentioned your boyfriend has developed pneumonia in the last week, and that's probably one of the other reasons why he developed a fever. It's nothing uncommon that patients who have been on a ventilator for 4 or 5 weeks now develop pneumonia. No matter of how well intensive care teams treat the ventilation, there's always a big risk of pneumonia being developed. Also, as I have mentioned in my previous email and on our Skype call, your boyfriend needs to be less agitated, because otherwise it'll be a big challenge to be weaned off the ventilator. I know it's frustrating to see your boyfriend getting Seroquel, clonidine, haloperidol and morphine, and the list goes on. However, it can be extremely challenging from a nursing and medical perspective to look after a ventilated patient with tracheostomy when they are confused, agitated and non-compliant. Again, the withdrawal from alcohol or from sedatives and opiates is huge as well, and that's most likely the first step to get the agitation under control, and then look at weaning your boyfriend off the ventilator. Keep doing the physiotherapy and also keep asking for mobilization, as this will help as well. Do not and never take no for an answer, and do not, under any circumstances, copy the behavior of other families in intensive care who don't ask questions, who don't do their own research, who continue to be intimidated by the perceived power and the perceived authority of the intensive care team. And those families, as a result, have no peace of mind, no control, no power and no influence. Make sure you are distinctly different from the 99% of families of critically ill patients in intensive care. and keep asking questions, keep doing your own research, and make sure that you do whatever it takes to get peace of mind, control, power and influence. I hope that helps, Vanessa. Let me know if you have any more questions, or if you want to jump on Skype or on the phone for a consultation again. So, how can you become the best advocate for your critically ill loved one and get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find our international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype or over the phone and via email by clicking on the email and phone consulting tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.